Welcome to Flipping the Table. Today we offer Michael's conversations with three of his colleagues from the campaign to create the Health and Equity and Racial Justice Fund. Our guests are leaders from organizations working with Roots of Change and 7 other inspiring organizations to place in the California state budget an annual fund of $100 million to provide grants to community-based organizations, implementing actions that improve public health and combat racism. Enjoy the show.
Hello, I'm happy to share a conversation about a California policy campaign directed by 11 nonprofits, including 3 that are represented by my guests today. Together, we seek to create the Health Equity and Racial Justice Fund, which would make available an annual pool of $100 million to provide grants to community-based organizations working to improve health and eliminate racial hatred in the places they live. Here's a background. Last summer, our group was successful in moving the California legislature to include the Health Equity and Racial Justice Fund in its final 2021-22 budget proposal to Governor Newsom. But the governor axed the fund from his final budget that went into effect last October. He promised to consider the request in the budget process this year. Sadly, his January 2022 proposed budget does not yet contain the Health Equity and Racial Justice Fund. So we're pressing him to hear our reasonable request before he offers his revised budget proposal in May. My guests include Mar Velez, State Policy Manager for Latino Coalition for a Healthy California. LCHC is an organization with which we have worked on several successful campaigns in the past. And Mar leads LCHC's policy agenda and incorporates community voice in all policy initiatives. She holds a dual master's in public health and city planning from UC Berkeley. As a daughter to immigrant parents from Mexico, who has had to overcome systemic barriers herself, it is Mar's passion to undo cycles that lead to negative life and health outcomes. Rod Lew is the founder and executive director of Asian Pacific Partners for Empowerment, Advocacy, and Leadership, known as APPEAL. It's a national nonprofit created to advance health justice issues for Asian Americans and for Native Hawaiians and Pacific Islanders. Rod has over 30 years of experience in developing national models on cross-cultural leadership, capacity building, community-based research, strategic planning, and policy change. Ron Coleman is the Managing Director of Policy for California Pan-Ethnic Health Network, known as CPEN. He leads the organization's legislative, budgetary, and administrative advocacy portfolio and manages its policy team. Ron is an attorney with years of policy campaign experience, having worked for the ACLU, California Immigrant Policy Center, Low Income Consumer Coalition, the California Street Vendors Campaign, ACORN, and Alliance for Californians for Community Empowerment. So these 3 are seasoned veterans at change-making. Let's begin the conversation. Hello, nice to see you all. Rod, Mar, Ron, good to see you. Thank you for joining me today for this podcast about the Health Equity and Racial Justice Fund. Really glad you can make it. So I think I'll start, and I'll just call you each out with the question, but I'm going to start with you, Ron. Why has CPEN joined this campaign?
Thank you for your question, Michael. CPEN joined this campaign because back in July of 2020, CPEN sent a letter to Governor Newsom asking him to declare racism a public health crisis, followed by funding and accountability alongside Black-led organizations, Black Women for Wellness, Action Project, California Black Women's Health Project, Public Health Advocates, and Roots Community Health Center. Since the onset of COVID-19 pandemic, we have witnessed the brunt of the COVID-19 pandemic fall on Black, Native American, Latinx, and Pacific Islanders in California. And while the governor has yet to declare racism a public health crisis, CPEN and partners continue to advocate for funding and resources as well as accountability for the state to address the systemic root causes of racism and not just their manifestations in health inequities and social justice, and actually correct the really serious inequities that we saw rise as part of the pandemic. This was a fund that we created, specifically the Racial Justice Innovation Fund, to ensure that we could address racism and social justice with community-led and community-determined programs. California has led the way in tech and science, but we often fail in how we address racism and health inequities in communities of color. And so since the time we started on this trajectory, the Racial Justice Innovation Fund merged with the Health Equity Fund to become the California Health Equity and Racial Justice Fund we have today.
Great. Okay, so it sounds like you've got a very large group of organizations that have joined with you in the origins of this. And so you came to this campaign with a network.
That's correct. Certainly there was a lot of movement building in the streets, particularly because of the violence we saw from police on Black Americans. And so we started working with Black-led organizations that were determined to put accountability onto Governor Newsom, particularly as it related to these issues, and get him to declare racism as a public health crisis. However, the governor has not leaned into that calling and has not actually declared racism as a public health crisis, but we still moved forward to work with many of my colleagues who are here today to work on advancing the Health Equity and Racial Justice Fund.
It makes a lot of sense just knowing the history in the last, particularly under COVID, of violence against both Asians and Latin Americans, Latinx families, or people in this country. So I can see the tie-in and the unity there. So I'm going to go to you, Rod. What's your answer? Why has Appeal joined this campaign? Is it similar? Is it different?
Yeah, it is similar to what Ron said. I mean, we've been working in chronic disease prevention with Asian American, Native Hawaiian, and Pacific Island populations for nearly 3 decades. This is a true opportunity to address root causes of both inequities and injustice. And so I thought there was a prime opportunity to partner with our colleagues here to really address something that's been on our minds for quite some time. And, the populations that we work with are 2 of the forgotten populations, Native Hawaiian, Pacific Islanders, because they're also often lumped in with Asian Americans, and actually a group that has faced one of the greatest impacts from COVID. But also Asian Americans get left out because a lot of the data is aggregated, and it kind of masks the great vulnerabilities that some of the subgroups, such as some of the Southeast Asian groups, face due to COVID and other chronic diseases and injustice. And clearly the rise in anti-Asian hate has adversely impacted our community. We need solutions to address the broader context of racial injustice.
Okay, very similar themes. Mar, I'm going to hand it to you now. What are the similarities? What are the differences?
Yeah, thank you. Thank you, Michael. Yeah, so LCHC, we're a Latinx-led public advocacy organization. I really want to echo what both Rod and Ron have highlighted in terms of, what the pandemic really exposed in terms of health inequities all across the state, but particularly for communities of color, including Latinx communities. I mean, over half of the deaths in terms of COVID were Latinx deaths, unfortunately. And so that is along racial lines, right? And we know that Latinos in California, a majority of them do hold essential workforce positions, right? We essentially did not stop going to work. We were definitely at the front lines. A significant portion of frontline workers are Latinx. And so this was an absolutely common sense piece of legislation for us, given that we know that the communities that we serve really understand the needs, right, and the issues on the ground in terms of health inequities. And so we really appreciate what the Health Equity and Racial Justice Fund is doing in terms of giving communities that voice and that self-determination around, really understanding what issues we need to address for our communities. So it absolutely makes sense, both in this time, trying to respond to COVID, but also the historic inequities that we know our communities have faced for a very, very long time. and that often, the best solutions for those issues actually come from our communities directly. So this absolutely addresses that, and it really empowers communities. And so we 100% got behind that and are very happy to be co-sponsoring this with our colleagues here.
Great. Well, I'll just say that Roots of Change got involved for a number of reasons, but something that you mentioned, the fact that Latinx workers are on the front line in agriculture and basically the entire food chain, as are many low-income folks from different ethnic racial groups in the state of California. So if you care about the food system, you have to care about health equity, because we don't have agriculture and the basis of survival without a healthy workforce. So it's apparent to us why it's so important, and that we also know that nutrition is such an important basis for health and health equity. People have to eat well. So that gets me into the next question. What can these funds be used for as we imagine the fruition of this campaign, and we actually have $100 million a year that can be distributed directly to community-based organizations? I'll throw it to you, Rod. What do you see this money be spent on? I'll ask each of you what you think.
Well, you mentioned food security, and I think that's where I'd like to start. A couple of weeks ago, we hosted a listening session in the Central Valley for Native Hawaiians, the Pacific Islanders, and Asian Americans. And a newer Native Hawaiian Pacific Islander organization, CVPIE, Central Valley Pacific Islander Alliance, talked about how they really were greatly impacted by COVID, where food security became a credible issue for them to get support on. And there hasn't been a lot of funding for community-based organizations. And there's also been a disconnect between some CBOs and communities and providers of other types of programs like health departments. And so this type of fund can really help provide the building up of food security within each of the communities that are marginalized, plus also helping to navigate the system, which has been a barrier to actually reaching some of the communities in the past. So I think there's a kind of a twofold impact of this particular program.
Mm-hmm. And Mar?
I think the heart of the Racial Justice and Health Equity Fund is that we would empower communities to really pursue their self-determined projects. So, I look at legislation that's even like in the books now, like Health for All or Food for All, where communities really understood, right, where the system was broken, right? So in terms of really providing opportunities for anyone, regardless of immigration status, to actually benefit from the systems of California, given that they contribute, right, in terms of tax dollars, that was identified by community members. No one else in the legislature, I think, would have brought a piece of legislation as bold as Health for All or Food for All. And so those are exactly the kinds of solutions that I think we really want to resource and support and say, communities know themselves the best. Let's identify those issues and let's build some systemic solutions for those things. Just in my own backyard, I live in Oakland. During the pandemic, we saw the way that Black women came together, right, to address the issue of housing in their community. Black Moms for Housing came together and identified the issue that there were predatory hedge funds, right, that were buying off houses and putting them at ridiculously above market value, right? And no one of working class status was going to be able to actually afford those homes. And so they took it upon themselves to expose that issue. And then, that reverberated across the Bay Area. And so, a lot of local legislation has sprung from that kind of activism, that kind of organizing. And so those are exactly the kinds of solutions that only community members can really identify and mobilize around and create systemic solutions for. So things like that. Yeah, exactly.
Great example. Ron, what are your thoughts?
I totally agree with my colleagues here. Dollars would be in the form of an ongoing grant program in which CBOs, tribal organizations, and clinics could apply directly for these resources. CBOs, we know that they need ongoing flexible funding to do the best work. This could include programs such as participatory budgeting processes in local cities and or counties. It could include mental health and substance use prevention programs, community gardens that serve local cultural needs, and more. This is really about redistributing redistributing and providing additional resources where identifiable gaps exist. These dollars would go directly to change lives and improving local conditions and empowering people of color. And it would actually reduce health disparities.
Mm-hmm. The challenge that I think we have, obviously, is the health departments can be very slow in getting money out, right? There are two things I'm hearing. One is we want communities to decide how the money gets spent. We want them to define the projects that they see that are most needed where they live to improve health. The second piece I'm hearing, the money needs to get to them. What are your thoughts about why we have decided to create a direct fund rather than going through the state of California's health department or the local health departments, which are affiliated and connected?
CBOs actually know what works. Top-down approaches do not take into account local needs. Communities are left out, often not at the table where decisions are made. CBOs have cultural and linguistic relevancy to their neighbors that they serve. Counties are often bogged down in politics and red tape, and we already know that many counties like Kern and Yuba actually withheld funds from progressive organizations that were trying to serve their communities. We trusted CBOs with vaccine outreach and education, Medi-Cal enrollment forms, and more. So why not trust them on health equity and racial justice? We absolutely need to empower our community-based organizations to continue to provide the services that they've been providing for decades. But the state actually needs to invest some of their dollars because philanthropic dollars are not enough. We actually need stronger investments, a statewide investment, in order to tackle health equity and racial justice innovations.
We hope you are enjoying the conversation. If you are, please rate our podcast and offer a review. Your voice will help us grow our listener base, which helps us sustain the funding to share these conversations with the people and organizations shaping a more just and regenerative future. A future in which the food and farm businesses are helping to solve the largest challenges of our time.
So Mar, I know that there are a lot of organizations supporting this effort. Do you know the actual amount of organizations?
I think the last time I checked, it was 214, and I think we just added 4. So we might be at 218 now. So there's plenty of support across the state for the Health Equity and Racial Justice Fund. I think now more than ever, CBOs, tribal organizations, and clinics have been at the forefront this entire 2+ years during the pandemic. And unfortunately, it took something like this, this worldwide catastrophic event, for them to say, you know what? We are a part of this solution. We are a part of public health. We are a part of what helps things run. And all we're asking for is that the state recognize our role in providing services, solutions, and empowerment so that our communities can continue to thrive, to exist. So it's really the opportunity for the state to acknowledge them and say, you're right. We need to resource you. Thank you for all the work that you've done. And we appreciate everything that you're doing for our communities.
Great. So, Rod, I know you have a long history of working with tobacco money. Appeal has, or work, supporting tobacco education programs that were, it's a form of achieving a health equity by lowering the cancer rates and the other illnesses that come from smoking. It's been very powerful and had a lot of positive impacts, but I've also heard critics say that it was sometimes too top down. I'm just curious, kind of building off Ron's concerns about top down and how most public health programs are operated. What is your sense? I mean, you came onto this, you want programs to get, CBOs to get funded directly. Is it partially because of your experience in previous programs?
Well, I think it's the fundamental belief that community-based organizations are the lifeline for communities. And I would summarize why CBOs are important with describing what I would call the 4 I's, and I mean the letter I. And that is, community-based organizations are best placed to initiate, identify, implement innovative programs that are most appropriate for communities. Mm-hmm. And those 4 I's really fall on kind of one key factor that Ron mentioned, and that's the concept of trust. Community-based organizations have the trust of communities. And that's absolutely critical in a time where our communities are under attack. They need to rely on those groups that they can trust through thick and thin, who have been there, who've demonstrated that they understand what communities are going through and how they should go about working in partnership. And I think the other piece is the realization that COVID has not only had an impact on us individually and through communities, but it has had an adverse impact on community-based organizations. We need to build community-based organizations as a lifeline back up to where they were before and beyond to adequately address health inequities and injustice.
Yes, I can attest to that. We worked on a project last year in Los Angeles, the Let's Feed LA County campaign, to feed over a 9-week period to distribute $23 million worth of food benefits to primarily undocumented families. And there was no way it could be done unless we enlisted 19 community-based organizations and paid them to set up systems for reaching the clients, the community members who trusted them and listened to them, and went through a fairly arduous sign-up process that was required by the grant funder. We could never have done that, and the county could never have done that. That's why the county needed to reach out and find folks to work with. So I think that's a really good example of what you're saying about trust. And it was very innovative. And those 19 organizations shaped how the signups were done. There was a constant feedback. We actually did a whole podcast on it because it was so mind-blowing for everybody involved, including the CBOs. So I think that was a really good example for me and made me really believe how important the CBO community is.
I mean, I think this is the first step, is to fund community-based organizations. But the Health Equity Racial Justice Fund is intended to really look at systems and how systemic racism has made it difficult for our communities to engage. So what you talked about in terms of top-down approach, there needs to be assurances within this design of this new fund so that the monies are going in a good way, that there are partnerships, equitable partnerships developed between health departments and community-based organizations, and that we are really trying to build up communities again through a mechanism that hopefully will be doing things in ways that other ineffective programs have not been successful in reaching equity.
Mm-hmm. It seems to me that reasonable people would see the value of this. And when you consider that California has a $3.5 trillion GDP, or 16% of the United States GDP, this one state, for the 5th largest economy in the world, it seems to me that $100 million is a drop in the bucket. I'm hoping that's just the beginning, because this kind of work, it seems to me, could be magnified tremendously with more funding. You know, what would keep the governor of California from actually supporting something like this? I'm curious. Mar, what are your thoughts?
Michael, I am also curious. We think it makes a lot of sense to fund our communities, right? Because I think we have a common goal in terms of really understanding what the issues are on the ground and creating solutions so that we don't have disparities the way we've seen and the way that COVID has really exposed. Our public health departments have been sorely underfunded and divested from over decades. And unfortunately, this pandemic has really impacted them and really just exhausted them, right, in terms of capacity. We know that nurses are unfortunately just dropping, right, mental health wise, that they're just at capacity. Physicians, I mean, the whole system is really bursting at the seams. And who better else to step in than those that know our communities the best, like community-based organizations, tribal organizations, and clinics. And so we do that because we care for our communities, we know our communities, and we want to assist. So I would say that unfortunately, just this investment over the years might be creating a tension that we're seeing, where unfortunately, it feels like we're competing, but we want to make it clear that we absolutely 100% support full funding for our public health departments. We cannot do this work if our local health departments are not fully funded. We need them to be fully funded. And we need to really step up and see the added value that community-based organizations bring to the public health system, right? We're just asking for the proper recognition of the role that our CBOs are playing in this response and the ongoing addressing of health disparities in our communities.
Great. So Ron, I'm curious what you think about what would keep the governor from signing. Is it similar to Mars, or do you have other thoughts?
I'm kind of curious at what would keep the governor from moving forward on this, especially in a year where we have record surpluses once again. It just makes sense to invest in a program that we know will actually advance health equity and also help deal with the evils of racial justice that has proliferated through our communities. Certainly, California's governor has supported community-based organizations and trusted them to get information out to communities throughout the entire pandemic, whether it was on vaccines, whether it was on messages on how they protect their friends and families, whether it was census a few years ago. Certainly, we know that the governor likes partnerships with organizations that are trusted and that can get messages to their communities in a cultural and linguistically appropriate way. So we'll see what the governor is going to do on the Health Equity and Racial Justice Fund this year. It makes a lot of sense to invest in this fund directly to community-based organizations. But, quite frankly, I can't come up with the reasons why the governor wouldn't support something like this that is going to go far to really help manage a lot of the health inequities that are rampant in communities of color while also really tackling racial justice. We've heard a lot from the governor on racial equity and racial justice. We haven't seen the investments.
Mm-hmm. Ron, what are your thoughts?
The question is really about how do we solve the inequity and injustice puzzle that we have in our state? And what we're saying is that a critical piece has been missing, and that is the community-based organizational, tribal organizations, and clinic piece of this. We will not get to the completion of the inequity problem unless that piece is there, along with all the other pieces that we mentioned, health departments, health systems, and other pieces of it. So my question is, why not support that missing piece of the puzzle in order to get to equity?
Mm-hmm. I'm encouraged by what you're saying. Yeah, the governor has said a lot. And actually, if you think about health for all and the way he's helped undocumented folks in past legislation, there does seem to be a commitment. So yes, I'm very hopeful and curious as to why he wouldn't sign this in a year with such a huge budget surplus, knowing that a small investment relatively of $100 million would have huge leverage effect for the whole public health system. You would have boots on the ground with people who are employed and recognized and boosted for the good work that they can do. And it would just add synergy. And we know from not just COVID, but we know from climate change, the number of disruptions are going to be coming into the future. And we have to have a robust public health system. If we've learned anything, what Mar brought up, that underinvestment in public health, that's been a disaster. And it revealed how bad those decisions were to disinvest over the last decades. And hopefully there'll be a reversal. I do hear a lot more people talking about public health investments than I used to. So I want to just get some closing thoughts from each of you. One thing I'd like to hear, at least one of you maybe could speak to how anyone who listens to this, who lives in the state of California, could help the campaign. Maybe Mar, you want to kick it off and give us some of that information. Any closing thoughts, and then we'll go around.
First of all, just want to thank you, Michael, for inviting me and LCHC to be a part of this. We truly do believe that together we can, make it a reality that there will be an ongoing line item in the California budget for community-based organizations to support the work that they've been doing for a very long time. In order to get involved, we do have a website, herjfund.org. And so we update the website pretty regularly. There's a calendar on there that tells you when the budget item will be coming to committee, when there's an opportunity to provide a Me Too and express your support for the fund. And then also, if you can't, call in, there's social media engagement that we also do. We tweet at the governor, we tweet in support of the fund. We provide all kinds of outreach materials for you to talk to your constituents about the Health Equity and Racial Justice Fund to support it. And so I would say that's a great resource if you're looking for more information and want to get plugged in. Absolutely.
Thank you. Ron.
Yeah, I would just add our thanks as well from Appeal for having us be a part of this. And I think I wanted to focus on the fact that this is an opportunity to address inequities and injustice that many of our communities of color and other marginalized communities in California are facing. Our organization focuses more specifically on Asian Americans, Native Hawaiians, and Pacific Islanders. But what's unique about this opportunity is that we are working across communities to make this happen. But I also see that some innovative strategies are working across communities to really address this. And so this investment, and I think it's an investment for the future, will really allow us to not only address the issues in distinct communities, but across communities and for all of California together. So it is something that is going to impact the health of our state. So thank you very much for the opportunity to be part of this.
Absolutely. Ron.
Thank you very much, Michael, for having us here today. I mean, look, I think we're all excited that we have seen Governor Newsom go far in investments as it relates to health for all, food for all, EITC. But at this point, we keep addressing the symptoms of racism, and we aren't actually investing directly in tackling racism at its root. And so we absolutely think we can do that with the Health Equity and Racial Justice Fund, both as we address social determinants of health and racial justice throughout communities in California. And for that reason, we're here to support this effort with all of our colleagues and hope anybody listening out there can support the fund as well.
Great. For those who live in San Diego, Los Angeles, Fresno area, San Francisco, Oakland, or Sacramento, the week of April 18th, we're going to be doing some social media events at different offices of key legislators who are going to make a decision around this and impact the governor. And if you're interested, just email Doris at rootsofchange.org, Doris at rootsofchange.org, and we'll get you hooked up with the right people to participate in that event. So that would be great because we're just trying to get a big wave of support from community-based organizations all across the state that week before he makes his decisions, because his next big decision is what they call the May revise, is when he comes and gives his revised budget for 2022 and presents it to the state and to the legislature. And so that'll be the next chance to see what he's thinking and for us to test our hypotheses around whether he's going to support this or not. So anyway, I want to thank each of you. You're inspiring leaders all. I've been following all of you and enjoying working with you through the years. And so thanks very much for your time and your insights on this campaign.
Thank you for listening, and thank you to our sponsors, the Ladybug Foundation, Dan and Quincy Imhoff, Beth and Mark Wyatt, Cindy Daniel, and Doug Lipton. Roots of Change is a program of the Public Health Institute.